And still talking about vaccination, pregnant women in Ashanti region to receive COVID-19 vaccines, immune boosters introduced. The Ashanti Regional Health Directorate has begun the administration of COVID-19 vaccines to pregnant women. Immune boosters shots have also been introduced to curtail spread and harmful effects of COVID-19 on pregnant women and the general public. There's more in the following report.
The initial rollout of COVID-19 vaccines in Ghana excluded pregnant women, which health experts say was premised on skepticism. However, recent local and international findings have confirmed the vaccines are safe to be administered to pregnant women. Speaking at a press conference, Ashanti Regional Director of Health Service, Dr. Emmanuel Tinkrine, allayed fears associated with pregnant women being vaccinated and encouraged expectant mothers to visit various centers for their jab.
Now, evidence have shown that we can immunize pregnant women. And because when they are pregnant, their immunity is quite low. It means that if you have a privilege and the risk is very low, and you immunize pregnant women, it will be better. From evidence-based or from our scientific knowledge, we now know that the vaccine is safe for pregnant women. So nobody should think of abortion, miscarriage, and other things. It may be coincidental. You may take the vaccine and you may abort. Sometimes abortion happens spontaneous, but don't associate it with the vaccine. On the other hand, if you take the vaccine and you have any reaction, the first thing you have to do is to report to the nearest healthcare facility.
Assuring the safety of the vaccines, Dr. Tinkrine underscored expectant mothers can receive Pfizer and Moderna vaccines.
We are recommending Moderna and Pfizer for the pregnant women. And then the first dose will be given as early as possible in pregnancy. And then the second dose will follow that of the general population.
Dr. Tinkrine indicated the Health Directorate has initiated a booster policy for persons who have completed their primary vaccination 3 to 6 months ago. The targeted category includes persons with underlying health issues, health workers, persons aged 60 years and above, security personnel, and members of the various arms of government.
We know that immunity for COVID-19 usually wanes. So when you take the vaccine, from 3 months to 6 months, you realize that the immunity will drop a bit. And for that reason, for the high-risk group, we are starting the booster vaccination for them. We will give the booster dose 3 months to 6 months after the second dose.
From Kumasi for JoyNews, Emmanuel Bright-Kweko reporting.
So we are live on the Pulse, and if you are just joining, you can also log on to all our social media handles. It's on JoyNews on TV. Let's take a break, and when we return, we'll bring you all the latest from the sports world.